Hi everyone.
Hello.
Hi,
Hi.
Hi there.
hi
Hi.
Paresh. Hi
Hello.
Naiyya. Hi Avlokita.
Hello.
Hi.
Hi, everyone.
Hi. So,
Hi.
yeah, Rohit, you want to start?
I will just introduce the moderator today, and that's my limited role. And
Mm-hmm.
then maybe I'm sure Paresh will do much better job than me.
Yeah.
So Paresh is the moderator of the session. I've seen email exchanges between all of you. Paresh is an engineering manager with Hair Technologies. He's worked with Tata Interactive Systems in the past. He's a is a leader in the location services team and is working on improving location search services at Hair Technologies. Over to you, Paresh.
Yeah. Thanks, Rohit. So, first of all, a very warm welcome to our panelists, and also a welcome to all the attendants. So, good morning, good afternoon, good evening, everyone, wherever you are. Uh, during these times, we realize the importance of healthcare. So when I think about healthcare, we all might have read some phrases while we were studying, like "health is wealth," "a sound mind in a sound body." So these are the times which are actually making us realize what's the importance of health. And when we think about healthcare systems, which basically assist us to remain healthy and provide some guidelines. So there are various issues that we are currently facing in the healthcare systems, um, like say the rising costs in the healthcare, then pressure on the existing systems, which is mainly due to the sheer population, the increasing demand in medications, and also this yeah this culminates into huge waiting times, and also a demand surge creates higher costs. Then we have staffing shortages, as we have more and more options for the people. However, there are very less people who are now taking more specific courses, or having some specific information. So yeah, there are staffing shortages as well. And a bigger challenge is regulatory changes due to, and that's due to information unavailability of centralized decision making bodies. So if we have a centralized system where the information is stored, and if we have that being used to make some long term decisions, then there wouldn't be some frequent regulatory changes. So these are some of the challenges that we are facing in the healthcare systems. And so specifically when we talk about healthcare, when we talk about the diseases, so we are all aware of the current pandemic situation. So it's actually pressurizing the healthcare system, and it has allowed us to look into other alternatives. But at the same time, we do have many people who are actually working towards uh, yeah working towards solving these problems, solving specific problems through the use of technology. So let's get an introduction of our panelists for today, who are actually working on the ground, and who have actually taken it up to them to solve certain critical areas. So we have Miss Avlokita Tiwari, who is the co-founder and CTO of AarogyaAI Innovations. So hello, Avlokita. So
Hi,
if you
Paresh.
can just
Thank you.
briefly provide us like what Arogya AI is.
Sure.
And yep.
So AarogyaAI is actually just over a year old. We are working on developing an AI solution for diagnosing drug resistance in tuberculosis. I'm sure not everyone knows, but India has 30% of the world's burden of tuberculosis. We have 2.7 million new patients each year. And a huge problem is that diagnosing the drug resistance in the disease, because people get sick and they don't take medicines. The medicines that they are given, they don't show effect for like 6 months sometimes. So if you're able to give them correct medication from get-go, especially people in the very poor sections and rural sections of the society where they cannot get a doctor to meet with them all the time, I feel that it's a big step towards actually eliminating the disease and curing people. Using AI, definitely, that's something we should be doing. So that's what Arogya AI is all about.
Yeah. Thanks, Avlokita, for providing an
Thank
insight into what AarogyaAI is. Definitely, will come back to you to
Yeah.
get the details.
Mhm.
Then we have Miss Naiyya Saggi, the
Hi.
CEO of BabyChakra.
Hi,
Yeah,
Paresh.
so
Hi, everyone.
hello.
Great to be here. I'm expecting that you want me to give a very quick intro. I'll do that
Sure.
right away. So, with Baby Chakra, what we're building is actually is an intelligent companion to parents through the journey of pregnancy and parenting. I think as Avlokita pointed out, the problem statement at her end, at our end also, the problem statement is actually very large and actually an amazing one to solve for. 40% of kids under 5 in the world are actually based in India. India has the highest birth cohort in the world, right? 28 million children are born every year in India. So massive opportunity to really transform as a nation our health and wellness outcomes just by focusing on families through the period of pregnancy and parenting. That's what we really do at Baby Chakra. Just very quickly, something very interesting about Baby Chakra is the fact that parenting is a new journey for parents who have a child, and we've really seen the role of machine learning and AI actually help in predictive personalization on that journey to ensure that parents, even before they reach that stage, they are able to prepare better on caring for that stage. So happy to
Yeah.
chat more through this conversation.
Sure. Thanks, Naya. That's an interesting aspect. I, being a parent, I know that the dilemma that we face when we hear it, the, at least for the first baby, like what to do, what not to do. Even though we have lots of information available online, but yeah, it makes a difference to have something. Yep. Uh,
Great.
Thanks, Naya. Then we have Mr. Ivan De Becker, who is the technology analyst from IDTechEx. So, Ivan,
Hi everyone.
how? Yep, please go ahead.
So just a few words about myself. I have a PhD in clinical medicine from Imperial College in the UK, and I work for a market intelligence company also based in the UK called IDTechEx. And basically, what we do is we provide market intelligence on a number of different technologies. I myself work in life sciences, and as I've been working in this field, I've been exposed more and more to AI. It's become very difficult to avoid this topic as it's becoming more and more prominent in life sciences, healthcare, medical technology, etc. And so, yeah, what IDTechEx does really is to provide information on this field, both technical and business, and really to provide a breakdown of companies that work in this field, and market analysis and everything that helps companies facilitate the commercialization of their technology, essentially.
Mhm. Okay. Yep, that's interesting. So, as you rightly mentioned, the AI is no longer an alien term for any of the industry, and it's more important to this healthcare systems, um, because that's the greatest we have reached in the technology, and it should be used for the most important purpose, and that's the healthcare, right? Okay.
Absolutely.
Yep. And then we have Mr. Neeraj Mehta, who is the CEO of ImmunifyMe HealthTech. So, yeah, Neeraj, I see your health tech organization uh, playing a pivotal role during these times, because it's mostly related to vaccination, having a centralized depot, and also please provide us some insight into what Immunify Me does.
Thank you, Paresh, and you guys have a great panel, great introduction. Um, Immunify Me, you know, as Naiyya pointed out, uh, every year there are almost 28 million children who are born in India, almost 50,000 every day. India also has a problem of vaccination. Not India also is the home of the largest, unvaccinated children in the world. When we started working on this, me and my co-founder, when we started working on the idea of vaccination, we understood that we need to, involve technology. We need to leverage technology from where we can monitor the vaccinations for children, because it's not only a problem in India; it's a worldwide problem. 1 in every 5 children remains unimmunized, and India it is much more. Um, so what we did, we realized a lot of things. There are a lot of things which goes on into monitoring vaccinations, and government spends almost 21,000 rupees on each child for vaccinations. But still there are not only money, but there are a lot of other logistics which are involved. One of the most vulnerable thing which we found out was using the paper booklet. We still record the vaccination of children on a paper booklet, and once this is lost, we do not keep a backup. We do not have a backup. Many of the doctors hospitals, they have started recently, but usually when you go out in the public sector, I mean in the public health, we do not have that record. And unless we realize that, unless we have a centralized digitized platform where everything is there, especially the vaccination records, because all of the other records are getting digitized, whereas vaccination was not. So what we did was we tried to replace that entire paper booklet, this thing, with the with this card. This, I mean, you don't need this. Is there is a QR code which is right here, and the doctors can actually scan this QR code, and all the vaccination records come in front of them. So it becomes easier, time saving for them also, and with the inbuilt reminder system, and there are many more other things which is there. Parents also, they are reminded on time that the vaccination due date is coming and you should take the. But that's one part. We also use a lot of machine learning, and we identify with the in the especially in the public health, we help the government identify because see, there are a lot of umbrella vaccinations campaigns which happens. For example, pulse polio, which was happening. Thankfully, because of the pulse polio, we are a polio free country now. But when it was happening, we would go out and give it to anybody and everybody who was below the age of 5. Just go and give do boon zindagi ke. That's what that was the thing which was there.
Punchline. Yeah.
So yeah, but a lot of time and a lot of resources was also being wasted in that, because even if that person has got, the child has got, he would again go and give, because we had no other option. We didn't know whether the child has got it or not. So monitoring, that's what we do. We are a part of Serum Institute of India, which is playing a pivotal role in manufacturing the vaccines. In fact, we have already started the production of vaccines, but there are many more challenges right now, which I'm sure we will talk later.
Sure.
Yeah.
Yep. Thanks, Neeraj, for the detailed information. So I have some queries, questions to ask. So before I ask those questions, I have a request for all the attendees. If they have any queries while the discussion is on, you can please put across your queries in the comment section, and we'll get back to those queries during the question and answer session at the end. Okay. Okay, so for I have a question for Avlokita. So you mentioned Arogya AI bridging the gap and helping for the cause of eradication of or taking care of TB. And TB is such an huge problem in India that, as you correctly mentioned, it affects around 2.7 million people a year, and thousands die each year. So we need something that actually works to solve the problem. since Arogya AI aims to bridge the gap between the research on micro problems of TB which are going on and the translation into usable public application. So there are some researches happening, and when we see it's not translated into public application, and that's the uh, gap that you are trying to identify and connect, right? So how do you use AI or the technology in this aspect?
So basically, for us, the input from a patient is the sequence of the organism that is infecting the patient. Because if you have the genomic sequence, then using AI to correlate all the possible mutations, for example, that are correlated to drug resistance is very straightforward then. And what we did using AI was figure out a method that will make it much faster, a model that is much reliable, and a solution that will be much more accurate for the patient as well. So that was the kind of angle that we took to solve tuberculosis, or basically try to see the way we can actually diagnose this drug resistance for each patient individually. Like Naiyya said, that it has to be a very precise kind of a model healthcare. Every person is different, every person infected with microbes is different, and having that kind of a personalized care, whether it's TB or anything else, is very important. What we started with is TB because it's such a huge problem, but that was the idea of using AI, because if you have a component that can actually give a holistic approach to the disease, that makes it much better for the patient, which is what we were aiming for.
Mm-hmm.
So better
Okay.
quality of care.
Yep. So then, yeah, as you correctly mentioned, so having the data and then finding out some patterns from it, and then providing some ailments. That's what
Yeah.
Arogya AI looks into.
Yeah.
So it's an interesting thing. I Someone has commented. I should take it at the end. However, it's tempting that uh, there are questions that if AI is there, will the disease decrease? I know it
Absolutely.
won't. Yeah,
No, absolutely.
please go ahead.
But because if you have AI and you have the correct medication, like I said from get go, then the idea is that the spread of the resistant disease stops. Because if you have TB, you're sitting in your home and coughing, each and every one of your family members is getting infected. Whether the latent infection is turning into a full blown infection depends on their immunity. And that's too big a risk to actually leave it on people. And there used to be times when you would be completely quarantined if you had TB and stuff like that, but that doesn't happen anymore. So the idea is to first of all curb the spread of a drug resistant infection and then try to kind of cure it. And we might not be able to eradicate it. I mean, polio has gone down in India so much, it's almost non existent, but it still exists in the world. You cannot eradicate it. But the idea is to actually make sure that it's not spreading, and it's not spreading in its drug resistance, especially because if a drug resistant infection spreads, it propagates, it gets more and more resistant. As it spreads through the environment, it picks up more drug resistance. And that is really, really dangerous, which is the whole point of trying to counter it.
Yeah. Yep. Thanks for that insight. And as you correctly mentioned, prevention is better than cure. So
Yes,
even if it is early diagnosed, even if the systems help us to early diagnose it, then yeah, it definitely curbs the spread. Oh,
precisely.
yep. Thanks. Avlokita. Now, for Naiyya, I have a query. As you correctly mentioned, that BabyChakra partners with families in this beautiful journey called parenting. Now, I was just eager to know how do you manage your platform, because when I went through BabyChakra, it is the fastest growing platform for parents to discover care for their families. So how do you manage the sheer amount of data that you have, and how do you exactly use the AI components over there?
Sure. So, I mean, of course, the first part was how do you even get to that level of data and to have those data sets in place, right? That was the trickiest part. It took us the last 3.5, 4 years to get to the critical amounts of data to even ensure that our algos started learning from the data sets and started becoming smarter. So that really was the uphill battle for us. But today, very proud to say that we have data sets from more than about 30, 35 million families longitudinally who've used BabyChakra. And across different regions and different languages and different life stages, with different interests. So we have all of these sort of category mappings, right, laid out. So we kind of have these aggregated data sets, which we're now able to sort of deploy our machine learning algos and sort of really sort of distill the right sort of insights from them, and also ensure that there's some element of self-learning that happens along the way in terms of personalizing the user experience for each individual family who uses us today. Now, how we are deploying machine learning today in today's context is in two ways. The first is, Paresh, given you're a father, and I'm sure many of the folks attending this session also are parents or have kids at home. What you will find is that either with a doctor or the questions that a parent has are about 97%, like almost like frequently asked questions for that life stage, right? When my child starts speaking, is how do I think about what to feed my child today? When do I start the whole weaning journey from breastfeeding, exclusive breastfeeding to like complementary foods? All of these are pretty much like frequently asked questions, right? So for there, we have already a very basic algo that kind of kicks in and says that since you're at this stage in life, you might want to start getting ready for this stage, right? So let's say you're in your 4th month of breastfeeding, and we know you've been complying with exclusive breastfeeding because we're kind of tracking that behavior and seeing your questions and sort of working with you through that process. On the 4th month, we say, okay, now start yourself mentally, emotionally, physically preparing for weaning off your child on exclusive breast milk and now moving to a complementary food structure, which, by the way, could be this sort of a format or this kind of a diet, right? So that's the first thing, right? The FAQ kind of thing that's personalized to each parent based on what we know about that parent already. So that level of personalization. The second very interesting personalization we built in is actually on a doctor to patient level. So not many people know this, but BabyChakra actually has a very strong B2C play, which is just direct to families and families who use us. But the second is actually we have more than 2,500 healthcare providers on our platform, and they in turn actually refer their own patients to BabyChakra so that they can actually engage with them better. And especially in COVID, that journey is accelerated of referrals quite exponentially, as you'd imagine, right? Because the physical touch point is lost today. So they're looking at a digital touch point to engage and retain and sort of work deeper with their patients, right? So with doctors, we've actually figured out some very specific care protocols that we're now implementing for each patient, and also a very strong feedback mechanism per patient that goes to the doctor. Now, all of this data would not have been possible without machine learning again, right? Because there's only so much you can do of the processing at the end and sort of distill insights on. Or also, sort of ensure that the doctor and the patient are, sharing the right information or the right sort of feedback with each other in a timely basis. So that's the second way we're actually using machine learning. It's still evolving, of course. It's still very nascent. It's still evolving. But that's the second way we're really looking at making this happen. And the third is, parents actually learn through communities. We've all grown up in we all say it takes a village to raise a child, right? So on BabyChakra, I think very interestingly, we've created a virtual village, right, of parents, of doctors, of other care providers. So not just doctors and experts, but also like nutritionists, early educators, folks who can help with, speech development delays, etc. So what ends up happening is, as part of this community, we're able to therefore use machine learning to connect a single parent to the right care provider or the right community of care, the right individual who can provide care based on some of the feedback that we get from them and the data sort of that we have on each individual journey. If we see sort of fall off course, off sort of the normal, like the aggregated pathway, we kind of call it out and be able to triage that to the right care provider in an automatic fashion. So that's a third way we're using machine learning. See, all of these journeys, honestly, today, Paresh, I would say hand on heart, we're probably just about 5% where we want to be, right? And I think that's where the opportunity really lies. I'm really excited about the future for this to play out on BabyChakra.
Yep, that's interesting, and that's good to know. And the first thing that you mentioned is, I think, the most important problem to solve, getting the data. So once you have the data, I think we have the systems and tools uh, available who can crunch that data and make some decision. But getting the correct set of data and getting the correct set of parameters and having in mind what you want to do is the crux to application of the technology. Yep. Thanks, Neha, for your insight. And this is interesting. I'll get more details about BabyChakra, and try to find out how it helps my existing problems which I have with my kids. So I'll definitely look into it. Thanks.
Sure.
Yeah. Okay. To you, Ivan. So in this ever expanding and specializing market, uh, just like our universe, so the need for in-depth research, business intelligence, and analysis has increased to make better decisions. Now, IDTech does provide independent market research and events for over 2 decades, right? So, since you are already present in the panel, I think you would you have rich knowledge about the market needs, the way forward, and common pitfalls that are against the common thinking in this domain. So many a times there are some myths around the technology, around the usage. So if you can throw some light on what are the common pitfalls and what is the way forward in this
Sure. So
healthcare domain. Yep.
as you said during your introduction, so at the moment we're really seeing the aging of populations throughout the world. So it's estimated that the number of people over 65 years old might double in the next 10 years, which is absolutely huge. And so because of this, people are becoming weaker and more prone to illness. And so because of this, we're seeing an increasing prevalence of chronic diseases, things like cardiovascular disease, which are extremely prevalent. And so as these diseases are rising in prevalence, we're really becoming desperate for technologies that will enable the management of these diseases and provide higher standards of care for patients. But at the moment, healthcare systems around the world really are struggling to keep up with the demand that is being caused by those problems. So we're seeing overburdened doctors, nurses. Really the entire healthcare systems are really struggling to cope with the number of patients, the really the pressure that's being put on them. And we're also seeing increasing costs, which are limiting the access of currently available treatment options to the patients. And so I think that the rise of AI can be directly, correlated to these current issues. And I think an important kind of application of AI at the moment is in medical diagnostics. So as we said, currently healthcare systems, doctors are really struggling to see patients. So that means that each patient gets less time with the doctor. Doctors are getting more and more, say, medical scans that they need to analyze. And AI can really provide support, decision support for these doctors that need faster insights and better insights so that they can properly diagnose the right disease. So if I can take the example of image recognition AI, for example, that's being used currently by some hospitals to analyze medical scans, medical images, say, for example, a brain scan or a chest x-ray. The AI is really helping doctors to detect abnormalities quicker and also more accurately. So that helps to reduce radiologist fatigue, and it helps to reduce the chances of human error, which can be very costly and lead to problems down the line for the patients. And it's also helping doctors to prioritize patients. So the AI can, for example, inform the doctors which patients need to be seen more urgently, so that allows more efficient allocation of resources within hospitals. And the importance of AI really, especially now that deep learning elements have been incorporated, is that it can improve over time. So the AI learns from the data that it's being exposed to, and it's becoming better at its role as it kind of learns from as it learns from the data that it comes across, and becomes more valuable really over time.
Okay. Yep. Uh, mhm. I think that's an interesting aspect, and also there were some queries like will AI take the entire healthcare, and so what I think is it it definitely wouldn't take away the human angle from it. We do need a human touch. The only thing, as you correctly mentioned, is just the AI will act as act in a manner to take away the issues that we have, and that's by assisting us. So it's just an extension of our knowledge base, which helps us in making clear and proper decisions. So instead of we doing some repeated task and failing due to fatigue or any other conditions, it will just make sure that it does better analysis and then helps us with better data, so that we take proper decisions. And also it can help assist in making decision making, but ultimately it would be the actual human who would be looking at the other person.
Exactly, yes. So the AI, it's never going to replace humans. Really, it's really designed for providing assistance, whether that is in telemedicine or in diagnostics or any other application of AI in healthcare at the moment. The key really is to provide the means to doctors, radiologists, and so on to be able to provide the best possible standard of care. But humans will always be needed in the equation.
Yep.
Absolutely. Yeah.
Thanks Ivan. Now coming back to Neeraj. Now, Neeraj, we are in the virtual session, and that's due to the current pandemic. And the only thing the world is waiting for is the vaccine. And since ImmunifyMe fills the gap of missing relationships between vaccination data, immunization gap, and individual health records, I think. Do you feel that it would play a vital role during this pandemic once we have a vaccine?
Yeah, see, once we have the vaccine, and I keep my fingers crossed that we get it soon. Uh, we will, there will be a few, cause of concerns which will be there. I mean, it is something which I feel while being in this industry. It's not a huge problem, but there are problems of counterfeit vaccines.
Hmm.
You know, because of the kind of fear psychosis this COVID-19 has brought into public.
Hmm.
Once the vaccine comes out, there might be more, criminal elements which can come, and they might just get into, some counterfeit vaccines might come in.
Hmm.
Counterfeit vaccines are nothing but pure distilled water. It doesn't have any adverse effect on humans, but it will not be effective also. You know,
Hmm.
so that's something which is a cause of concern. So identifying the vials which are authentic vials. So right at the time of giving the vaccine, authentication of the vial is one of the concerns which we are working on currently. Then there are logistical issues like who is going to get it first. But of course, that's not something which we have to decide. That's on the government which has to decide on. The third one is monitoring the person, somebody who has already got the vaccine,
Hmm.
because a vaccine development process is from research to coming into the market is about 10 to 15 years. Now what we have done is we have accelerated that entire process in 6 to 9 months. So there might be, you know I'm again, uh, there might be some long term effect which we might not know on the humans what will
Hmm.
happen, though every scientist and everybody wants to make it safe for humans to consume it, but we don't know, because the long term effects of 1 year, 2 years, 3 years, we don't know as yet. So monitoring the monitoring people who would get the vaccines, that will be important. Another one would be, in all probability, these vaccines are not going to be one dose vaccines. They are going to be more than one dose vaccine. I'm talking about in terms of COVID vaccine. So
Hmm.
identifying that is also very, very important. So maybe the efficacy will be for 6 months. So after 6 months, you need to get another dose. So sending them reminders, monitoring them. Is there any adverse effect on them in 6 months or in 1 year? That becomes important. So that's what another thing which we are doing. The third part which we are helping right now is, the air travel. Air travel is, people do not want to travel, and economy depends on. So if you want to open
Yeah.
up economy faster, you also need to open up air travel faster. How do you do that? So we are currently, again, with Serum and with Gavi, we are working on something like, and IATA, of course, we are working on something to bring out a COVID passport. It will be on your smartphone. It will have a QR code which immigration officers and the airlines officials can scan
Scan.
again and track whether this person has received the vaccine. He has got the vaccine or not. And if he has got, when did he get? Did he get it 6 months ago? Then he has to take it again. But if he has received 1 week ago, then we know that he's kind of immune till next 6 months. So he can travel freely. It will help the countries to open up
Yeah.
their economy, to open up their airports and travel sooner.
So
So
it
that's
would
where
help in easing compliance.
yes, that's what
Okay.
we are currently working on,
Hmm.
and hopefully everything goes all right and we have the vaccines commercially available by the end of this year or probably by early next year. Then
Hmm.
all these things will help. Another thing which we help, Paresh, with the governments actually
Hmm.
using our own machine learning is identifying the areas for a particular vaccination campaigns. For example, when we while working with government of Bihar, we realized that in one particular district, and in that district also, in one particular geography of that district, children were not, they were missing out on MMR vaccine. MMR is the measles vaccines,
The measles.
and while we realized that, while we saw that this geography is not getting that, we could alert the authorities for, there might be an outbreak of measles which can come into this particular geography. So all these things have become possible because we use AI, we use machine learning a lot. And I feel AI is here to stay. It helps you. I mean, the human intervention is definitely not going to go, but it definitely helps you
Yep.
diagnose things more accurately.
Yep. So, thanks, Neeraj. And I think everyone is working towards a society where we are seeing healthy people around, and uh, maybe in future we would, when children will learn about diseases, it would be a history, because they would think, okay, we already have systems which diagnose it much early in the cycle, and we do not have to suffer. Thanks, everyone. We have some queries. Uh, so I'll just pick up some randomly. Uh, as Neeraj, you were mentioning about the COVID-19, assisting the authorities in this COVID-19 situation. So, is there any other app except Arogya Setu in which AI helps us to detect any disease? I think anyone can pick this up.
I think there are a lot of apps where you can put in your symptoms and at least get an idea of what the ballpark might be of your disease. Of course, you still have to
Mhm,
go to a doctor for any
mhm,
prescription or a final checkup.
mhm,
But I know there is even this Babylon Health, which is based in UK. As far as I know, not in India, that you can check your symptoms on. But I don't think you can make a definite like a diagnosis that this is for sure is what you have. You still have to visit the doctor.
mhm.
We're not
Yep.
there yet, where it can be done online, basically.
And
I
just
mean, there's a very simple example of the Apple Watch, right? I mean, it's basically taking your vitals every minute. And in fact, I mean, we're living it, right? I mean, all of us either have like a smartwatch or we have, another sort of device where our vitals are being tracked, and it's basically giving us feedback on what are we doing, what's working, what's not working, alerting people if there's like a cardiac arrhythmia that's playing out. I mean, all these events that are playing out. I mean, like, we're sort of trying to understand if there's a play for, and it already exists in the market. So I don't know. I mean, I would still think about the innovation we do there, but like a fetal heart rate monitor. So
Yeah.
these are all sort of this sort of hardware with software on, the manifestation is an app, but these
Right.
solutions are already amongst us and within us.
Yep.
I mean, there's another very interesting one that I'm still trying to figure out more details on, and it came to me. It's interesting. Came to me as an angel investor, so I have to figure out if I want to continue. I'm looking at it still. It's actually a technology where you speak into it. It actually understands if there are any underlying health issues that you have.
Emotions.
So it's quite
Any
interesting.
psychological
Also,
issues.
yeah.
Yeah. Recently, I was also reading an article about doing COVID testing using voice. So it ultimately depends upon how deep the network is taught, on how many samples, and what is the relationship that it has created. So one of the question is related to that, like how crucial is the data collection, and an accelerated or limited case like now, uh, would it affect the outcomes?
I think the kind of data that you pick to train your AI algorithms really are quite key. To predicting and ensuring that the algorithm will work the way you want it to in the future. So, for example, if you want an algorithm to be able to detect disease efficiently, you need to take into account the fact that you need to have different population demographics, for example, patients of different backgrounds, types of tissue, gender, and so on. All that will play a role into ensuring that your algorithm will be able to detect disease in as wide a population range as possible, and that will ensure that it can be applied to different countries, different diseases, and really to make sure that it can be as versatile as possible.
Hmm.
The
Okay.
data is the most crucial part,
Yeah.
that I'm sure everyone here would agree. For AI, that's the main, that's gold.
Hmm. Yeah, data is the new oil. That's what we say, right?
Yeah.
Okay. And maybe we just have time for a last question. So it's like, can AI replace doctors in healthcare industry? Anyone?
I think AI is very important to help doctors in the industry, but it's not designed. The idea is not for AI to take over and to make the decisions instead of the doctors. It's really to provide insights that will allow the doctor to make more informed decisions. So the doctor will always need to be there.
So maybe it may remove the diagnostic aspect, because it may be able to diagnose as we go ahead and we have more and more sensors. But ultimately, the decision for medication and the decision, you would need some personal touch, because uh, ultimately AI is, as we earlier discussed, is an extension. So it would be complementing our limitations. It would not replace our knowledge base. So
Yes, it can extend, expand our capabilities. Yeah,
Exactly. You
absolutely.
can make it faster, sure, but
yeah.
definitely not replace doctors. Yeah.
Okay, so that's all we have today. And any like I want each one of you to say at least one uh, ending remark to our audience.
I'll go first, I guess.
Yeah,
So
yeah,
we
Divan.
really, even though AI is really not a new concept, it's been around for several years, if not decades now. But at least in healthcare, we're really starting to see the benefits now in the last, say, 5 years or so. So it's still relatively new. AI is not perfect; it's still learning. We are still learning how to make the best use of it. But it's very clear that the value of AI in healthcare is really immense, and it's not going to go anywhere.
Mm-hmm. Avlokita.
I feel like AI is really going to help a lot in healthcare. Seeing an end to end with AI integrated into it, whether it's through bedside genomics or ICU care or with baby care, it's definitely not going to be more than 5 years where you actually can't even imagine a world how did it exist without AI. So I think we are getting there pretty quickly.
Thanks. Neeraj?
Yeah, I'm so sorry. I went, no, the electricity went right at the nick of the time. So,
Oh.
yeah, if you want to ask me that question, if you, what you were asking me, that
So
would
it's
be
just a ending
nice.
note.
Otherwise,
Yeah, it's just a end note to our audience,
okay.
like one or two sentences that you want to convey to
Yeah,
our
right.
audience.
No, again, I agree with what Avlokita and Yvonne said, that AI is here to stay, especially in it will play more and more bigger role in healthcare, especially in towards the diagnosis side. And also when you look at it from a business perspective, 5 years ago, 2014, the whole AI industry was about 160 million, and 5 years later from now, it's about by 2026 it is it is supposed to be going around 150 billion. So AI is a good thing for all of us, and AI is actually here to stay.
Yep. Naiyya?
Yeah, so I have a little bit of a different view. I mean, of course, I believe AI is here to stay, and I'm really excited and very, very bullish in the potential. But I think just a word of caution, AI can be very biased, right? Depending on the data set it gets fed. And we've all seen it play out. So I think just one word to everyone, because I'm assuming everyone here is interested in AI and the implications it has on healthcare. I think what we're doing is really important, and we need to do more of, which is actually democratizing and making our data a lot more inclusive. Because over time the care might extend and expand, but if we don't have the right data sets to sort of feed our logic and the AI, then either we exclude certain populations from the care or we give biased care to them. So I think that's just a thought I'd leave us with.
Yeah.
Agreed.
Thanks, Naiyya, for that different view. So before we end,
And which is why
I
I
just
want to close saying I'm open for collaborations,
yeah,
basically.
exactly. So before we close, I just want to uh, ta- have some key takeaways. That is, you need to have the correct set of data if you want to use AI. Second thing, AI is a tool. It's not a magic wand that it will do something for you, but it's a tool. It will perform as you provide the data to it and as you create models on top of it. So it's just like another tool. It's just that it's very powerful, so you can utilize it to your benefit. And yeah, in this healthcare domain, I think since we as humans would have the same model for centuries, so it's the best thing we can apply to the healthcare domain. Okay, so with that, I think we are already we have already crossed our time. So thanks to all the esteemed panelists for your insight and giving your valuable time. I hope whatever you mentioned would definitely inspire our audience. So in fact, I'm really inspired by looking at the variant perspectives and the different domains and how AI binds everything together. And I can really see a bright future if everyone, takes up some problem statement and try to mitigate it for the good. Yep. So
Thank you so
thanks
much.
everyone. Thanks panelists.
Thank you
Thanks
all.
audience. Yep. Bye.
Thank you.
Bye.
Thank you, Paresh. Thank you for inviting all of us. Thank you.
Thanks, Azhar.
Thank you, everyone. Thank you, all the panelists, for such an insightful session.
Mhm.